I would like to introduce our next speaker. Is Corie Mina. She's with Amedisys, and we've had also, like Home Instead, we've had Amedisys talk before. And one reason why I like to have Amedisys come talk is because they have therapists, physical therapists, occupational therapists, speech therapists, who are knowledgeable about Parkinson's disease. And this doesn't always happen, that home health agencies have Parkinson's knowledgeable people. So this is a good thing. And I am trying to find Corie's presentation so she can give her presentation. And let's see, where is it on my computer? Oh, good heavens, I have way too many windows open, looks like. Let's see, can I do that? Yes. And I'm not sure you're seeing my screen though. Let me see. Share screen again. I'm sorry, everybody. Corie, are you there?
Yes, I am, Robin.
Okay. I'm sorry. I'm looking for your presentation. I loaded it on my machine. Oh, here it is. I'm sorry. I just had to scroll down. And let me, Corie, do you see your presentation?
Yes, I do.
Okay, very good. All right. Just let me know when we're ready.
Okay, I'm ready.
Okay, very good. Okay,
first I'd like to say thank you for Robin for inviting us to be part of this presentation. My name is Corie Mina. I'm with Amedisys. I've been with Amedisys for about 3 years now. I've been in home health for about 10 years. So let me start off with letting you know what home health is about. So home health care provides skilled, now that's the key word, is skilled, services for an illness or injury wherever you call home, with the goal of helping you recover, regain your independence, and become as self-sufficient as possible. Amedisys Home Health offers services such as skilled nursing, an RN or an LVN, home health aides, physical therapy, occupational therapy, speech therapy, social work, and some nutrition services also. We also offer specialized clinical programs that focus on empowering you, the patient, to manage your own illness and make good decisions. Robin, can you turn the next slide, please?
Yeah. There we go.
So again, our services are, we have a registered nurse, an LVN, a physical therapy, an occupational therapist, a speech therapist, a home health aide, and a social worker. So who is eligible for home health? So you may be eligible to receive home health care under your Medicare benefits. So part of that is we need you to have a skilled nursing need, a physical therapy need, or a speech therapy need. You need to be under a physician's care. All home health services has to be ordered by your doctor. Again, you also have to be homebound. Under the CARES Act, because of the pandemic, that homebound status is a little bit on the flexible side right now.
And can you say what homebound means and doesn't mean?
Okay, so it's in the next slide.
Oh, I'm sorry.
Robin, thank you. So here's who is considered homebound. You're confined, you're at home due to an illness. You don't have to be bedridden, but it has to be like a taxing effort, and that you need supportive device to to leave your residence. A homebound status is not affected when the reason to leave the home is to receive medical treatment.
And I think it used to be also that you could, homebound status was not affected. Say if you wanted to go to church or a synagogue, something like
Correct.
didn't
Yes,
affect the homebound status. Okay,
that's true. And you can also go and get your hair done or go to a barber.
very good.
Okay. So now who pays for home health? So under your Medicare, you're eligible and it's covered 100% by Medicare, meaning there is no copay. And if you have a private insurance, some insurances are also covering, home health care. Although some require that you meet your deductible. And so we would probably need to process your insurance to let you know what your copay is. Usually if it's a private insurance, there is a copay. Average copay is between $50 to about $100 per visit.
And can you say what Medicare may not cover? What an example?
It's Medicare covers for home health,
Mhm.
covers 100%.
Okay, all right.
So how do we go about if you wanted to have home health? This is what our referral process is. So you would need to go see your physician because we would need to get a face-to-face. Your physician then would write a prescription for the services that you need. If you're in a hospital, the hospital can also make that referral for you, as well as a skilled nursing facility can make that referral for home health. Also with Parkinson patients, your neurologist can also make that referral. What to expect for the initial visit. So on the first visit, a nurse or a therapist will be there to do an initial assessment. This will be a thorough interview and a professional assessment and part of our coordinating approach to managing your overall health status. So our assessment focuses on identifying areas where you may benefit from education in self-care management and partners with your doctor to promote disease prevention. In addition, we also provide hands-on intervention, which includes, teaching the family or if there's a caregiver involved. This team approach also helps to make the transition from the hospital or a skilled nursing facility to a home much easier. How often will the home health team visit? The frequency and type of home health visits and the services provided are based on your plan of care. So your doctor may change your plan of care, increasing it or decreasing it, the number of visits, like for instance, how often a nurse will come into your home, as well as a physical therapist. Our clinicians will do a custom care plan for each patient. And then we will also, get your family members, your spouse, or a caregiver involved in the training or in your overall care. At that time too, the team will also do a home safety evaluation and make recommendations. An example of that is they'll see what's around your home and they'll say, oh, that rug shouldn't be there because it could cause you to fall. So those are some type of safety evaluation. Or the shower, maybe you need a grab bar. So that is the time they'll do that evaluation and make that recommendation. One of our specialty program is what we call our fall reduction program. A little bit about it is it's based on a clinical practices that we've looked at, and it's backed by high quality care science. It does an interdisciplinary approach that gives you an access to a diverse team of professionals, from the physical therapist to the nurse to the occupational therapists. So it's an overall approach to your care. We have expert in the home where 75% of falls do happen. So we are aware of that, and we want to prevent that fall. We also empower the patient to take an active role in preventing that fall. What we also do is we have a fall detection system that we offer at no charge for about 120 days, where it gives you kind of a peace of mind. It's a service where it's kind of like a necklace that you put around yourself, where you can call in if you need help, and it could detect that you fell.
Is this like Lifeline or something?
Correct. Yes, similar to that.
Mm-hmm. And one question, I just want to confirm. In order to access this fall reduction program, which sounds fantastic, in order to access it, again, the person would have to be homebound, have the usual qualifications for home health, have a face-to-face visit with their MD, and the MD would provide a home health referral.
Correct. Yes.
And would the MD need to specifically mention the fall reduction program, or is that something that Amedisys can call the MD and say, oh, I think that the person would really benefit from our fall reduction program. Is it okay we provide that?
It can go both ways. We are normally, this is what a lot of our physical therapists are doing with current patients now.
Because I think this would be of great benefit to people with Parkinson's disease, where fall risk is quite high.
Correct. Yes.
Yeah. Okay, very good. Oh, let me see. I thought I.
Oh, next page.
Oh yeah, I'm trying.
Thank you, Robin.
Maybe my mouse isn't in the right place. There we go. There we are.
So this is what the fall detection system looks like. So we're offering it for 120 days. We pay for that service. And then if you want to continue with it, it's up to you. Again, this is for patients that are at risk for falls. And then, they push the button and ask for help. And there's a trained professional that's on the other end and will, report or find out what's happening. Again, this is kind of like an overall what we offer the patient, neurology patients. So from skilled nursing to physical therapy to occupational therapy to speech, and then also, teaching that patient and what our nurses would do. And that's it. Any questions?
And Corie, could you speak a little bit about the PTs or OTs or speech therapists you have on staff who are knowledgeable about Parkinson's disease? Do you have a few or at least one, and therapies can they provide?
Right. We have a couple. All of our clinicians, our physical therapists, we're one of the only home health care agencies that we have a full-time speech therapist that's been with us and has a number of years and is very familiar with Parkinson patients. She participated in that Big and Loud program. So she is familiar with how to deal with the Parkinson patients, as well as our physical therapist. He's also gone through that program and a number of years of experience.
Great. And I just want to make clear, and I want to confirm this with you as well, Corie. It's not that the PT or speech therapist will be doing LSVT big or LSVT loud with the client, with the patient. It's that because my feeling is that because they have taken LSVT big and LSVT loud, they know something about Parkinson's disease more as compared to the average PT or speech therapist who hasn't taken those kind of trainings. Would you agree with that?
Yes, that's
Okay.
correct.
All right, very good. Okay, let's see what questions we have. How much does it cost for each category of care by Amedisys?
So if the patient has Medicare, it's 100% covered.
Excellent. And then, as you said, if it's a private in some other insurance, then there would be some copay. And you indicated it was usually around $100. I think.
Well, it's between, so if they've met their deductibles, depending,
Oh,
everyone has different plans. So depending on their plan, some, if they've met their deductibles, they don't have any copays, even
okay,
if they have a
very good.
private insurance.
Okay, I hope there's Medicare by the time I get to be that age. That sounds like a
Me
good
too,
thing.
yes.
Okay, as somebody asks, does homebound mean, for example, after you've had deep brain stimulation surgery, which is a kind of surgery that happens in Parkinson's disease? So you've had surgery and you're now at home recovering. Does that qualify as homebound?
Of course, if homebound, and right now under the CARES Act, homebound is very flexible. So meaning under Medicare guideline, um, it's a taxing effort, meaning you can't go out, you can't go wandering around, you can't go on a vacation. That's kind of part of the reason why you can't go outpatient therapy.
Right. Okay. Yeah, the language about taxing is new to me. When my father used home health services, it seemed like it was a little bit more strict.
Right. Like I said, right now they're a little bit more flexible because of the pandemic,
Right. That's
meaning
great.
Medicare.
But I still want to confirm, you said on the slide that in order for the physician to provide a referral, the physician is required by Medicare to have a face-to-face?
Yes, meaning had either a televideo visit, a telemedicine visit,
Oh,
since
okay,
a lot
great,
of patients
great.
are not seeing their physicians in person, but we do need to have that, so to justify why the need for services for physical therapy.
Right. Okay. Let's see okay, somebody asks, exactly what does the assessment with the RN consist of with the patient other than taking blood pressure? Are your assessment nurses LVNs or RNs?
So that initial assessment, there's a list of questionnaires. So for that initial assessment, it's an RN. An RN always starts the care for that patient. An LVN would follow eventually later during the care. Right now in our Campbell office, we don't have an LVN. All of our nurses are RNs. So there's a certain questionnaire that they ask the patient, and then of course they evaluate what the need of that patient is, what the goal of the patient is, and then they go from there.
Right. One question comes up, and it's a little bit related to some experience I had with my father in home health. And the
Huh?
health agency themselves was able to provide home care or aides that came in and they showered my father as part of the home health benefit.
Correct. Yes.
Does
Yeah,
that still exist?
correct. Yeah. So we do have a home health aide that assists with, the bathing, maybe with some ADLs, but we do offer that.
Okay, and is that a part of the home health benefit such that Medicare would pay for that as long as home health is in place.
Correct, yes. And it can't just be the standalone. It's not like the doctor can just order a home health aid for bathing. So it
Right.
has to come with either a nurse or a physical therapist. But yes, it is offered.
Exactly. Okay. And then once home health ends, that would be then when somebody like a home instead could provide the home care that the home health agency was providing.
Correct. And or we work in conjunction for the
Right.
care for that
At the
patient.
same time. Yeah.
Correct.
Okay. Let me see if there are any other questions. Okay, I'm not exactly sure I understand the question, but I'll ask you anyway, Corie.
Okay.
Do they ask about ADLs and IADLs? Does that mean anything to you?
ADLs is, activities of daily
Daily
living.
living, and I is instrumental activities of daily living.
Right.
Yeah.
Hmm.
Not sure. Maybe if the questioner can restate the question, that would be helpful. Okay, let's see. Do I have anything on chat? That's all the Q&A. Where did my chat go? Oh, here's chat. One question for Leslie, if you are still there. You still there, Leslie?
I am.
Okay, great. One question for you is how much do the aides get paid? You indicated that the agency generally, a full service agency generally charges $35 to $38 an hour. How much do the aides themselves receive?
So it's all dependent on their experience, but we say that the average rate can be like up to $20 per hour, and then the agency, will take care of, and then that doesn't include like what the agency has to pay for their benefits and the overhead of that.
Right. And can you just briefly say what benefits Home Instead provides to the aides? Because I think you guys are a little bit unusual in that regard as well.
Sure. So we have paid sick leave. We also have an employee assistance program. We have 401k after they've worked a certain amount, and vacation, and then dental and medical if they work a certain amount of hours.
Okay, very good. Corie, I have another question for you.
Okay.
Is homebound an absolute criteria?
Yes.
Okay. And we talked about how that kind of is a little bit more loosely defined now with the CARES Act.
Correct.
And then another question is an OT assessment covered by Medicare?
Yes. And at the moment too, an OT now can do the start of care, but it can't be a standalone referral. So it has to be in conjunction with, has to be referred with a nurse or also with a physical therapist.
Okay, and I'll give this question to you, Corie. I think it mostly applies to you. Is there anything such as long-term home health care? So I think the question is getting at how long can home health provide care in the home or provide therapies in the home?
Okay, so for, like that, the skilled is a key word. So if we're done with their goal and there is no longer a skilled need, we need to discharge the patient.
Okay. And I remember there has been for a very long time, and you may be aware of it, Corie, kind of a controversy about whether when somebody, say with Parkinson's, is receiving physical therapy, but they're not really improving, whether Medicare will pay for that. Do you know about that controversy? And
Right, because there's only so much that you can do. There's certain limitations of that patient. So with that, it would be, there's no longer a skilled need. So that's
Right.
when we can't, keep coming because Medicare won't pay for it.
Right. Okay. Let me see. Another question. Since Medicare pays, can a person with Parkinson's receive ongoing palliative care of physical therapy, even if they are not improving? And I think you kind of just answered that. So,
Yes, yeah.
let's see. Can skilled services be delivered by televisits? That's a good question.
No,
No. Okay.
Medicare, it has to be hands-on.
Hands-on. And what could you, like Leslie did, could you briefly explain what sort of COVID safety precautions the therapists and nurses and home health aides
So
are taking?
similar to what they offer, we also have the necessary PPE requirements, where, they have the mask, the gloves, also what we do on a daily basis for our clinicians, they do a self-assessment, and majority of our clinicians now have been vaccinated.
Oh, that's terrific. Very good. And
Also to let you know, Robin, throughout this entire, since last year, we've seen COVID patients in the home.
oh, wonderful. Wow, that's terrific. And you've seen them in a somehow in a safe way.
Correct, yes.
Oh, that's wonderful. Well, that's great. Leslie, if you're still there, have you guys also seen COVID patients?
We haven't had any COVID patients, no.
Wow, that's very lucky.
And then too, I wanted to mention, our caregivers are required to wear the mask throughout their entire shift. So the client doesn't have to, but our caregivers are required to.
Okay. And I would imagine you prefer the clients to, but it's not required.
Yeah, it's up to them if they want to, but.
Okay.
Yeah.
And Corie, same thing for you?
Yes.
Yeah, okay, very good. Okay, I think we have a few more questions, but I want to be sensitive to the time, and we're over 4 o'clock now because my alarm just went off. So I want to reassure everyone that we will post. Corie, it's fine to post your slides as well, I assume?
Yes.
Okay, very good. So we will convert everything to PDF because not everybody has PowerPoint. So we will post Corie's slides, we'll post Leslie's slides. We will get from Leslie a PDF about the questions to ask home care agency. And we also have we'll post the 40/70, 70/40 pamphlet from Home Instead. And I will send out an email to everyone who received an invitation. So if you're on the invitation list, you will receive that email as to where we find a place to post all that good information. And I would like to thank Corie, Mina from Amedisys.
Thank you. Thank you, Robin. And Robin, you can also include in there, since in my presentation, I didn't have my cell number. You can provide that cell number if they have any questions. They can always call me.
Okay, sounds good. And I'll be sure that I have that so that I have the right. Why don't you just say also now what your cell number is, Corie?
Okay, it's area code 408-472-4577.
4577. Very good. And
thank you.
post all that. good information to some place we'll find on the Stanford website or maybe our Stanford blog site, and we'll let everybody know. And I'd also like to thank Leslie Kiefer, our other speaker from Home Instead.
And also, Robin, I can provide a document that outlines like medically what we can and can't do. So what
Oh, that'd be very helpful too. Thanks. There were a lot of questions about that.
yeah, I can do that too.
Yeah.
And then too, Robin, if you can stay on after, because I just wanted to chat with you for a minute.
Absolutely. And so we'll make sure that everybody here on the webinar has Corie's contact information and Leslie's contact information if you have follow-up questions. So thanks so much, everyone, for participating, and we'll hopefully see you next month. We have a palliative care team coming to talk next month. So thanks so much. Appreciate everybody being here.
Thanks.
Thank you, Robin.
And we will share the recording as well. Thank you so much.